And I'm joined now by the Eastern Ontario Health Unit's Medical Officer of Health, Dr. Paul Roumeliotis. Welcome, Dr. Paul.
Good to be back.
All right, so let's begin by where are we right now in this area in regards to COVID-19?
In this area, so far we have 4 cases, and 3 out of 4 of them were brought in from outside of the country or other parts of the country. The fourth one we're still investigating. So at this point, we haven't had any new cases in a couple of days. However, I think that the population should know that all around us there are increasing number of cases, and a lot of them have been in the community in Ottawa and other areas across Canada. So a lot of the measures that we're taking now, including continuing of school closures, closing down some of the businesses like the provincial order that was issued yesterday, effective today at midnight. A lot of these measures are really being done as if the virus was already rampant in the community, and I want to stress it's not. But I think we should be behaving as such because we don't want it to affect our population. And as we all know, and I've said it before on this show, the Cornwall and surrounding area in Eastern Ontario has higher rates of people with chronic medical conditions, and as such, we want to protect them, and as obviously the elderly as well.
And that's really what it's all about, is protecting the most vulnerable. So you did issue an order on the weekend further clarifying the closures as well, ahead of course, the provincial
Yes.
orders to close down non-essential businesses. But there is news coming in. It's not completely set in stone yet, but there is news regarding some daycares, I believe.
Yes. The announcements came yesterday, actually. One of them was that although we've closed all licensed daycares and private daycares, which I had, the government, and I think rightly so, wants to establish several daycares that will exclusively take care of kids of people who are working in frontline, healthcare workers, and so on. So I think it's very important. So we'll be working now with the local authorities and local municipalities and so on to ensure that the kids there are safe. There are precautions. There are infection prevention precautions that we need to be taking. The other announcement that came out last night, actually, with the businesses that are exempt from this closure that was imposed as of midnight tonight, is that we will be now looking at allowing private daycares who have less than 6 kids to operate, provided though that they're able to abide by certain infection prevention and pandemic sort of control precautions, like screening the kids when they come in, keeping distances, and washing, do all the stuff that we think is appropriate for as optimally preventing the spread of any virus in and out of those daycares. So those are a bit of the changes that we're making. But overall, we're still looking at telling people stay home, stay safe, and particularly, I can't stress it enough, people returning from out of the country should self-isolate for 14 days. That means go straight home from the airport, straight home from, if you're driving through the customs, if you're driving in. And doesn't mean don't go to the grocery store, don't go to the pharmacy, don't go to the mall. Just go straight home and stay there for 14 days. I can't stress that enough. We're getting hundreds of thousands of people returning, and we know that, especially if you're coming from the States or other countries that have high rates of infection, we don't want, if you bring it in, we want you to isolate yourself so it won't spread in the community.
And that's the perfect point to discuss this, because we're hearing so many stories on social media and just word of mouth of people that are coming over the border, especially in a place like Cornwall. The border crossing is right here, and people coming and stopping at Walmart or stopping at other stores. What is your message to people that maybe are also feeling unsafe?
I think my message is, first of all, call these people out. If you see anybody that has been out of the country, stay away from them. Stay, a couple of meters distance, 2 meters, two arm lengths away. You'll be safe. Wash your hands and so on. But call them out. I think it's important. I've been discussing this with our police officers and partners in municipalities, because we do get a lot of these complaints, and rightly so. We should call them out. And at some point in time, if, for example, I see an individual who is positive for COVID, let's say we know that he or she is positive and is out and about, I'm going to issue a quarantine order that has all kinds of fines and potentially being arrested like they have in Quebec. And I know that as we move forward, these measures may be imposed at a provincial, even federal level. I think we have to take this seriously. Don't go out and party. Don't go out. Don't go out unnecessarily if you don't have to. Avoid crowds. Stay home. Stay safe.
And finally, Dr. Paul, just an update on assessment centers. We've seen the first one open up in Hawkesbury. There is one coming to Cornwall as well in the coming days.
We are planning. Yes, we are. We're planning to have one ready to go in Cornwall and another one ready to go in Winchester in the SDNG area. The question is when. It has to do with really us being able to get them ready, which we can do quite quickly. But also it depends on the number of visits in the emergency rooms. We want to make sure that the emergency rooms are not overloaded. And so there'll be two steps. One will be that there initially be just testing centers, and secondly, when we get infection in our area, infections sort of more community based, what we'll be doing is we'll be switching from testing but going over into like a medical evaluation center. It'll be the same locations, but let's, for example, somebody, and like I said, 85 to 90% of the people will have mild symptoms, will not require hospitalization. But among those that might be worried, but they shouldn't go to the emergency room. And if they want to get a medical evaluation, recognizing that the emergency rooms will be taking care of sicker patients, and a lot of the family doctors have closed their offices and actually helping the hospitals and so on, I think people would have an alternative. So these assessment centers will then switch into a role of becoming an alternative place to get a medical assessment instead of going to the emergency room.
Excellent. Dr. Paul, thank you so much for joining us and updating our viewers on the current situation in the region regarding COVID-19.
My pleasure.